This conference will now be recorded.
All right. Well, hello everyone. Really super appreciate folks who are Oh, am I screen sharing? I'm not, am I? Nope. A little hard because you have to pull it up. Hold on. All right.
This
So
conference will now be recorded.
take two. So hi everyone. So excited to be here and run through the grant review process for this really exciting funding opportunity, expanding the capacity of syringe services programs to respond to COVID-19. Really unique and innovative project that is funded by the CDC and really, just exciting on lots and lots of different levels, really thinking through that this is one of the first times that the CDC has really almost, even kind of directly put money into syringe access programs. And so just really out the gate, really appreciate all the support from you all who have volunteered your time, who are volunteering your time to help us out with this really amazing project that is going to be a big lift and hopefully set some precedents for getting some real dedicated federal funds for syringe access programs in the future. So again, just super appreciate it. This is a big lift and it's been a really quick and short timeline of a project, but we are excited to be here today, to be at this place where we are almost got all the applications, and we'll get those all next week, and then we'll get these out to you soon. So just want to kind of frame that here. I am Laura Pegram. I'm the Associate Director of Drug User Health over at NASDAQ. And for those of you who aren't as familiar with NASDAQ, we are primarily a membership-based organization that works with the U.S. state health departments, their HIV and viral hepatitis programs, and increasingly over the last many years have expanded our work by building out the National Harm Reduction TA Center. So now we can work with programs and syringe access and harm reduction programs on the ground directly, providing technical assistance, helping to troubleshoot issues, helping to think through funding and sustainability. And so really just excited to kind of be expanding the scope of our work here to really work with AIDS United, our lovely AIDS United over here, to actually become grant makers. And again, this is super exciting and we so appreciate your support at the outset of this project here. So I'm gonna pass it over to my colleague Angel, and I'm very excited to be on the line with Angel today because I think it's a first for us, and that is always a nice thing to note. And Angel's going to run through the AIDS United, the portion of this review process that is facilitated by AIDS United primarily, and then we'll pass back over to me because the two tiers of funding that are facilitated primarily by NASDAQ have a slightly different, similar content, but slightly different platform and application process. So Angel, do you want to take it away?
Yeah, so hi all, I'm Angel Gomez. I am the program manager with the harm reduction team at AIDS United. Many of you might be familiar. In the past, we've done the Syringe Access Fund. And so now we're excited to add a new grant to the portfolio to offer syringe programs. And so I'm just going to go over with you just some brief information about the grant and then reviewing grants for our portion, and I'll get into more detail about that. So you can see on the screen, we have the full title, the Strengthening Public Health Systems and Services Through National Partnership to Improve and Protect the Nation's Health, Supplemental Funding for Expanding SSP Capacity to Respond to COVID-19. That's a big title. We're going to call it the COVID SSP Grant from now on because no one wants to say that whole title. So we'll go on to the next slide. I just want to pop this information on there. So this webinar, we didn't offer it live. We're only doing a recording because of that very quick timeline that we're operating under. But for those of you that are going to be reviewing Tier 1 applications, here's my contact info. So please feel free to reach out to me at any time. as we're going through this review process. And then there's all of the harm reduction team at AIDS United. So you can reach out to any of us. I'm the main contact for the review process, but any of our team can answer your questions if I'm not getting back to you quick enough, or maybe you just have a relationship with one of them. Either way, go ahead. So just real quick, this is what I'm going to be going over today. Just going to go over a big picture of the grant so we all have an understanding of what we're working with, and then just get into more details about the review process. And it says that there's a Q&A, but there isn't one. I forgot to delete that off the agenda because we're not doing this live. Go ahead. So about this COVID SSP grant. So this was a part of the American Rescue Plan Act, and it was in partnership with collaborative centers within the CDC. And it's providing resources to support our syringe programs and expand their overall capacity to provide COVID-19 vaccination, education, testing, and expanding services for additional adult vaccines. And it's administered through NASTAD and AIDS United. So this is a one-year demonstration project, but it's important to note that it's highly likely that there's going to be a no-cost extension.
It is
so
guaranteed.
Keep that in mind. Okay, so guaranteed.
It is guaranteed. So we should be thinking through this as like at least 18 months, if not a full 24 months, which is important in the review process, as some of the projects will look like they have a very short timeline, and on paper they have to look that way. In practice, we have a much longer runway to
No, thank you, Laura. So yeah, it's very important when you're reviewing these applications, even though they're all written for 1 year, keep in mind that the programs have the ability to go up to like 2 years with this funding. And so, I lost my spot. It's all right. So the big aims for this project is to strengthen the capacity for SSPs and serve as a critically essential access point for COVID-19 vaccination services, general response interventions, and then broadening adult vaccination services for people who use drugs. So that includes other types of vaccines like flu, Hep A, Hep B vaccines as well, can be incorporated into this. Let's see. Go ahead and go there. Oh, so there's 3 tiers with this grant. AIDS United will be handling tier 1, and then NASTAD is tier 2 and 3. So tier 1 is more of those basic on the ground type of work, and there's going to be 50 to 70 grants, where tier 2 and 3 are more demonstration projects. And if Laura, you want to chime in just a little bit.
Yeah, sure. So thanks so much, Angel. So yeah, this project, like Angel said, comes from collaborative centers, and so there's a lot of interest at the CDC from a lot of different parts of the CDC about what we want to get out of it. And so the way that that NASDAQ created this work plan to meet all of those needs was really this sort of tiered model. And you can refer to the webinar, which is posted on the RFP landing page on the NASDAQ website, which we can navigate to and make sure you all know where that is, and include those links in the email that we'll send you with this recording soon. But really envisioning some really low threshold grants that will go out through the AIDS United system, and then it's a couple, like Angel said, 2 different tiers of demonstration projects where we're going to get into some real learning that we are trying to get out of this project, really thinking through how do we build replicable models of care, really building out lessons learned and sort of facilitators of building out successful expanded adult vaccination services and COVID vaccination services on site or in close referral with SSPs. And so we'll go into those. And so yeah, those 2 tiers are going out through NASDAQ, and like I said, the first tier is going out through AIDS United, but this is a deeply collaborative project. So, you know, both of our project teams are working closely on all three, you know, kind of across tiers on this project. Even though the platforms are a little different, that's the one hiccup that can be a little confusing with this project, but super excited to talk through the different tiers as well.
Go ahead and go to the next slide. Just some overall project aims for this grant. So the big thing is engaging SSPs in COVID vaccination planning, outreach, and delivery. So we want SSPs to provide the education to their communities about COVID-19, promote the vaccine, and address vaccine hesitancy. And it's also to support SSPs to partner with existing vaccine providers to effectively reach people who use drugs, or possibly become vaccination providers themselves, or to offer co-located COVID-19 vaccines. It's also building SSP capacity and infrastructure that supports COVID-19 vaccine efforts, while also delivering effective harm reduction in infectious disease prevention. So it's assisting in development of long-term capability of SSPs to serve as vaccination providers, not only for COVID-19, but as I said, hepatitis A and B, seasonal influenza, and other vaccines that maybe certain SSPs find important in their regions. And it's also to support the core SSP operations. You know, SSPs are founded on infectious disease prevention, and COVID-19 is exactly that. So it incorporates really well, but we want to support them through their space, staff, and supply needs. It's important to note supply needs as permittable under federal law, so no syringes or cookers are allowable. Other than that, it's pretty wide open when it comes to supplies. So let's go ahead and move to the next slide. So just some funding priorities to keep in mind as you're reviewing these applications. So their ability to serve as a vaccine promoter or educator, again, they don't have to be the one administering the vaccines. It can be navigation, it can be partnering with another organization. It's really, we just want to make sure they have the ability to do that. And also their ability to provide high quality syringe service. You know, some of those priorities have high rates of HIV and viral hepatitis in their regions, and the ability to provide data collection and reporting. And then also the organization has cross-sectional or intersecting movements, organizations led by or serving people who identify as trans, gender nonconforming, Black and Latina communities, people of color, people who experience oppressive policing and mass incarceration, and gay, lesbian, bisexual, and queer people. Those are all priorities as well. Let's go to the next slide. So some basic eligibility requirements as you're reviewing these. Vaccine access. They must be located in an area where they have access to COVID-19 vaccines and other adult vaccination. There must be a CDC determination of need for their state or area, which is available, and we can include that link and map in the email we send out. So they must be they must be a nonprofit, and that can also include fiscal sponsorship as well. And then the financial stability, the organization should be fiscally stable and viable prior to submitting of the funding application, and these funds aren't intended to serve as a replacement for discontinued funding.
If I could just jump in one clarifying question. So nonprofit status is pretty broad in how we're using that. So it's not necessarily that they have to be a 501c3 nonprofit. A lot of health departments, county, local health departments do run syringe access programs. And in our book, those are not for profit as well. So syringe access programs run in the context of an FQHC or a health department are totally eligible for this. It's one of the most common questions we've gotten so far.
Thank you for that addition. So as reviewers, and this is strictly related to the AIDS United conflict of interest, Laura will go more into NASTAD if you are doing tier 2 or 3. So for those people doing tier 1, and you'll get this in the email as well, we highly value the participation of individuals who have firsthand community level experience with syringe access programs and policy efforts. So as a result, we expect that many of our reviewers may have conflicts of interest with one or more of the proposals submitted. And so in our commitment to having a review process that is fair and objective, and to avoid both actual or perceived conflicts of interest. So when a conflict of interest exists, a participant may be viewed as being in a position to gain or lose personally, professionally, or financially from a proposed project under consideration, and there are 4 primary categories. So it's current or past role with an applicant, and that can be employee, contractor, volunteer, board member. Having a personal relationship with an applicant, having a strong positive or negative feeling about an applicant, or having a partner, spouse, or child who is a current or has had a role with an applicant as well. It's also important if reviewers have any of these conflicts and the organization applied for a tier, they should not review applications in that tier. So if you're with an organization that applied for tier 1, you should not be reviewing any applications in tier 1. You should, and please note that when we send out your conflict of interest form. And also take into consideration if you have a perceived conflict of interest. Even if you don't believe one exists, it's important that we keep that noted so everyone feels like they're getting that fair review. Let's go to the next slide. So confidentiality. Participation in the review committee constitutes an exception that all discussions regarding the application agencies and funding recommendations are kept strictly confidential. All participants fully understand that the confidential nature of the review process and agree that they'll destroy or return any materials related to the process, not to disclose or discuss the materials associated with the reviews, evaluation process, or funding recommendations, and not to discuss participation in the review committee to anyone outside of the committee, and not to post anything related to the review on social media, and to refer all inquiries concerning the review process to me. And we ask that you don't seek advice about any of the application from colleagues or friends, because these proposals and applications are all confidential. So they should only be read by staff of funding organizations and the selected people for review. So as reviewers, you agree to maintain that confidentiality of all the application materials and not discuss the identities of applicants. So don't copy any material or discuss with anyone except for the staff that I've mentioned above, or other members that are reviewing as well. Let's go to the next one. So just some timeline stuff. So the deadline for having all of your scores back for Tier 1 to AIDS United is Friday, December 17th, 5 p.m. Eastern Time. Sending in your score sheets late will impact the overall review process and possibly result in an organization not getting funding. So please don't wait too long to start reviewing. Once you review the applicant packages, a recommendation should go in and at least review one application so you get the hang of it. So start that as soon as we send it with the one. This will allow you to ask questions sooner, not wait till the last minute. Waiting to the last minute to answer a question can become problematic because it might not give our team the adequate amount of time to respond or do research if we need to do that for you. see. And then reviewer fatigue is real. So don't try and review all the proposals in one sitting. The way you review the first proposal and the last proposal won't be the same if you try and do that. And the proposals in that second half won't get as fair of a review as the ones in the first. And then just a reminder, failure to submit your recommendations by the deadline might negatively affect that program. And if you have any challenges or you're unable to complete your assigned applications, let me know as soon as possible. I'll pop up my contact info again at the end. That way I can reassign it if needed. Or if anything comes up and you find out that you're not able to complete the full package, again, just let me know as soon as you know. All right. So just some quick stuff. So I'm going to go over our reviewer workbook, which is optional to complete. It's a spreadsheet that we'll send you all, and it's helpful. While this spreadsheet is optional, entering it all into Salesforce is not optional. And Shannon at AIDS United will connect you with that. They are on vacation right now, so they're not able to join this recording piece, but they will be available after the holidays to answer any questions about entering into Salesforce. So we're going to send you our applications and then this Excel sheet. Yeah, that first tab has the review of a lot of the things I'm going to go over, so you don't have to memorize it here. But please do review those application instructions before. So let's go ahead to the next slide. You can see there's applicant 1. You'll want to fill out that top piece right away. That first section is your organization's name and the amount they requested. And then once you're done reviewing the applications and going through the whole process, you'll fill out that second portion in box number 2 with your funding recommendation, which is like a yes, no, the recommended amount, and then the total points that you scored the application. So in that next portion, just a few tips as you're reviewing: take breaks, pay attention to fatigue, give yourself time. Make sure you look at all of the documents with the application. So not just the narrative, but look at the budgets, the representation tables, so you can consider that proposal as a whole. Take good notes. We're going to need those notes. It's really important for our internal team to have those notes when we're looking at your recommendations to understand where they came from and help us in our decision making. So as you're going through, there's a point system for the Tier 1 applications. And this, again, is in that workbook that we're going to send you. So you'll have this reference point. But when you look at points, so there's kind of a standard for 5-point questions. 5 is excellent, 3 average, 1 weak, or 0 it's missing. And so we have that same breakdown for 10 and 15 points. And when you're looking at an excellent applications, they've provided thorough, strong responses. Your average score, the applicant provided a response that addresses most aspects of the questions and prompts, with some parts not included or some of those parts weak. And then the weak score is the applicant provided a response that does not adequately respond to the question or prompt. And then missing, it's just not there at all. So when you look at the workbook, you have this second tab for each application with the comments. This piece is really important for us, that you go in and you fill in that yellow box with your comments on each question. So you'll give it a score, but we want to know why you gave it that score. That's a really important piece for us. And then when we go to the next slide, on that same tab with the comments, when you scroll down to the bottom, each question has that comment section, and at the bottom of that sheet, you'll see that we ask for 3 strengths and 3 weaknesses. Please include that as well when you're completing the workbook. Again, that's really important for us when we're going and looking at all these applications to make our funding decision. So like I said, that workbook is completely optional. We will also connect you with Salesforce, and you can enter your scoring and comments directly into Salesforce if that's how you wish to do it. If you have any questions about Tier 1 and the review process, please reach out to me. My email and phone number is on there. And if you have technical issues with Salesforce or having trouble navigating Salesforce, please reach out to Shannon, and I put their email there as well. Awesome, and I will pass it off to Laura to talk more about Tier 2 and
Awesome. Thanks so much, Angel. AIDS United has slides, and I opted to actually not have slides and kind of just run through what NASDAQ has done in the past with our current patient navigation project is actually very, very similar. And since that was a project jointly created with AIDS United as well, we are focusing largely on workbooks. And the workbooks are very similar. We've tried to streamline them a little bit for each of these different funding demonstration project tiers to make the lift lighter for you all, acknowledging that we want to take as little of your precious time and donated time, and I just super appreciate that. So really trying to make things as easy and accessible and streamlined as possible. And we at NASDAQ do not have to use Salesforce, which is a so just wanted to really note that there are real reasons for these differences in terms of who, which organization they're coming out of. And largely that has to do with the sheer number and volume of applications we anticipate getting for especially the very low threshold Tier 1 grants that'll be, sort of facilitated through the Salesforce system. Now, for the two demonstration projects, we really anticipate that the number of applicants or applications for those two different tiers will be substantially less. And so we were able to go like a little bit more old school, and honestly, that's my style. So things make more sense to me in a table than Salesforce, and just appreciate the patience with these diverging processes this entire way. One other thing I think that would be good for us to note is really of the very impressive sized volunteer pool that we have for review, what we're going to be doing is basically sort of randomizing you all into distinct tiers. So there's no possibility that you would be reviewing a Tier 1 application as well as a Tier 3 application or something, right? Like either you're going to be in the Salesforce system for Tier 1, or you're going to be given and emailed over one of these Excel spreadsheet workbooks for either Tier 2 or Tier 3. That way you're looking at the same tier across the way in terms of fairness, in terms of equity. Another thing that I think is a good general consideration, and something that we have, part of the reason I think that NASDAQ and AIDS United were awarded these funds to facilitate this very exciting, innovative project is because we know programs really well, right? We know people who use drugs, and we know people, we know the programs across the country in a way that federal partners and often state level partners are not as familiar with programs, and really understanding the capacity of many programs, that there's just a huge range there, that often some of the best programs are programs that probably maybe don't have a grant writer on staff. Maybe they do, maybe that's a volunteer, maybe that's a board member. So really thinking of, as we are going through this review process, really thinking through how to bake in some context, how to bake in some concepts around equity in terms of the way that we prioritize evaluating what is a good or maybe not as great proposal, right? So, one of the more immediate ways that I can really think of this is really focusing in on, I don't actually care if sentence structure is perfect, and if everything is perfectly tied up with a bow and spell checked and, all of those things. Recognizing that someone might be doing this, up until the very last minute, because there's just not that capacity there, whereas some larger programs might have access to a grant writer, that sort of thing. So really we're looking to prioritize programs that are pitching brilliant things, innovative things that will be broadly useful, and hopefully that we can get some really substantial lessons learned from, as well as just money into programs, into community, and really evidence to federal partners and state partners that it makes the most sense in the world to fund syringe access programs to provide COVID vaccination, expanded adult vaccination, kind of any of those services. But we need to make the case for why they need money to do that, which again, very logical. But really thinking through, caring less about the crossed T's and dotted I's and more about what are the great projects that people are pitching? What seems like a really good program, and how do we really bake in that equity? So I figured what I would do is just kind of screen share a couple of things. So I appreciate your patience with this, because I have a lot of things. You might see my crazy making, all the the tabs up on my browser and all that. So try not to judge me, because that would be, well, yeah, it's the recording. So like I said, we over here have approached this a little bit differently, a little more old school. But our RFPs, as well as a link to the AIDS United Salesforce RFP and platform, are all, there's a NASDAQ landing page that you all are probably very familiar at this point. All of these are linked here, right? As well as an overview of each funding tier. That's a kind of a one-pager, well, it's 3 pages, found here. So if you are having questions about the differences between the different funding tiers that you've been assigned to, there's kind of a little cheat sheet here. We'll make sure that all of these links are sent out to you all, so don't worry about that. Let's see, Angel had mentioned the CDC's determination of need. Now, the determination of need, we will send out the link to it. This is a process whereby the CDC, it's basically the way that we have been allowed to use federal funds for syringe access programs at all, with the exception of syringes and cookers. It's kind of a convoluted process where you have to go in and basically, triangulate some data in your jurisdiction that basically shows that you are experiencing or at risk for a potential HIV or hepatitis outbreak related to injection drug use. As you can see, the vast majority of jurisdictions in the country have completed their determination of need. And if you are in one of these 6 to 12 jurisdictions that have not, this is actually not an incredibly challenging process. NASDAQ is always here to help on these things. I've helped many of these purple states complete this sort of this process. So feel free to, well, don't hesitate to check in with us about that potential as well. If it's not for this funding opportunity, then others in the future. I think that this will continue being a thing that the federal government requires. So like I said, we'll include a link to this, always open to questions about that. Okay, so let's jump in here. So like I said, NASDAQ is primarily facilitating getting out and the review process, even though this is joint with AIDS United, the whole thing, for the tiers 2 and 3, which are the 2 different demonstration projects. You'll notice that the workbooks that we're going to run through right now look very similar, but just as a little background, the way that we're approaching some of the differences between Tier 2 and Tier 3. So Tier 2 is very similar to the patient navigation demonstration project that we currently have. It's a project that's also funded by the CDC that we currently have underway. So this is really much more sort of a, we are funding 6 syringe access programs across the country from a range of geographic spread, sort of, urban, rural, thinking through really trying to get the biggest spread of programs across the country that we can in order to sort of maximize lessons learned. This is much more qualitative and also some, aggregate data numbers, but also thinking through lessons learned, success stories, challenges. Tiers 2 and 3 are all grants that are cost reimbursable. So compared to AIDS United, the lower threshold ones, these tier 2 and 3 will require a good amount, much more in terms of actual like financial and organizational infrastructure in terms of monthly reporting, well, not monthly reporting, but like monthly timesheets and submissions for invoices, documentation around some of that stuff. So kind of keeping that in mind, that this organizations who are applying for this and chosen to be successful for this will require more of a little bit more infrastructure, and also NASDAQ and AIDS United, that's a big part of our job here too, is to help programs learn how to do this stuff and really help build in some of that infrastructure from an organizational point. Okay, so let me, oh, I never do this. Okay, so if you are selected to be a reviewer for tier 1 or 2, here's basically what we're going to send you. We'll send you hopefully no more than 3, maybe 4 applications. You know, this kind of depends on how many reviewers and applicants we have overall. We're still figuring that out. Again, try and be really mindful, keeping the lift as light as possible. So we'll send you their application materials, and then we'll send you this workbook, just like the one that Angel had kind of mapped out. This one's structured just a little bit differently, but we really tried to keep it very light and easy. Let me make this larger because, you know, that seems kind. Okay, so embedded within the workbook are instructions that are pretty straightforward. Like the AIDS United workbook, there will be, depending upon how many applications we send to you, there are application tabs for each program that you will be reviewing, each applicant. So basically you can just fill this out, right? Applicant here, I would suggest, say if it's like Venice Family Clinic and they applied for this, to change the application here, you know, the title here, so that it's easier to reference. And so then at the very top level, we go through eligibility, right? Like, should you even continue reviewing this? If, you know, and like if it's missing substantial things, or it doesn't meet the application criteria, eligibility criteria, then we want to know that before we get too much in the meat of this stuff. So I'm not going to run through these one by one. I feel like they're pretty straightforward, but really basic, all of this eligibility criteria and the primary considerations around you know, what we're prioritizing in terms of these projects are all embedded in the RFPs that are on that website, right? So you will have access to those, but you can also just trust that these are the things that we have pulled out, and you know, that programs who are applying will be responding to directly. So very similar to what AIDS United went through, determination of need, area where adult vaccination and COVID vaccination in particular are available. For the middle tier, tier 2 of the demonstration project, we want you to do that in 6 pages and not including attachments. And again, some of this is thoughtfulness around trying to just keep the lift light for our volunteer reviewers. And so we'll go into the attachments here in a bit. The attachments do not include budget. And that's like, or I'm sorry, the attachment does include budget, as well as the representation table and any other supportive letters of support or anything like that. So really, is the budget template there? Is the representation table there? What's the organization's annual budget? Do they include that stuff? And then finally, is it eligible? Assuming yes, yes. Right here, before we get into the grading part, we go through demographics that we've asked programs to put in when and where possible. A note here, we're really just trying to get your help in terms of feeding out some of these notes, comments, in sort of doing this first line of review, so that we don't have to, you know, really microscope down on absolutely every applicant. So really, you know, thinking through which region in terms of demographics, in terms of what the jurisdiction is, and then anything that, you know, you all could help us by pulling out some of any that jurisdictional HIV, hepatitis burden, any information that the applicant includes about COVID burden or COVID vaccination uptake within their program. If that is top line, if that is included in the application, super appreciate you all pulling it out. You'll notice over here, if it's not, we'll do that lift. We'll do that little research there. Yeah. Okay, so very similar. We basically stuck to a 4-point criteria, well, a 5 really, if you include 0, right? So similar to AIDS United, 0, can't evaluate, information's not there. Number 1, or you would give someone a 1 if the criteria was not met within the application. Number 2, for if only some criteria were met. Number 3, if criteria was met and satisfactory. And number 4, you know, you give them the full 4 if it meets expectations, exceeds expectations. So then going through, and just a note here, there's a notes and comments column here. So any unique things to pull out or notes, things that strike you as red flags or things that strike you as particularly impressive, innovative, always good to make notes here so that you don't necessarily forget and so that it really becomes top line for us as we're doing a more final committee review. Whew, okay, so then moving into the different focus areas that we have asked applicants to respond to within the RFP, right? There are some top line topics, right? So one thing that we need, because this is an emergency response project, and even with that expanded authority or no, you know, no cost extension that's guaranteed, this is still a quick project, right? We want to get these things out the door quickly. So we asked for things, you know, related to evidencing the capacity of programs to start vaccination programs quickly if they don't already. So thinking through, have they identified vaccine providers? Do they already do this? Do they already offer other, outside of COVID-19 vaccination services, what kind of other vaccination services do they or do they not indicate that they offer? And again, these are just yes, no, check boxes, and then notes, right? So what sort of, how do they show and talk about their community partnerships that might exist? Have any of the COVID-19 vaccine service providers indicated buy-in? This one's important because, you know, it's really, this is the place where we'll be looking for ideally some like letters of intent or statements of commitment. If they don't have those, it's not necessarily, you know, we're not going to say like, no, you can't do this, but it makes a stronger application the more proven partnerships that are shown and evidenced in the in each application, right? So yes, again, number and quality of submitted letters of project partnership, innovation level and uniqueness of innovation of what people are proposing. You know, programs on the ground are the ones that are brilliant, and we're really through both of these demonstration projects trying to learn the most from them and their experiences and how they approach these projects. So then overall for this whole section, you decide whether, you know, what they are going to be ranked as, and you just put your point value here. I like low numbers. I think it's easier in terms of math. And then we'll go through each of these here and just really briefly. So very similar to that, another big component of this is really the capacity to monitor and collect data on project activities. Given that these two demonstration projects are much more, you know, either qualitative and experience-based data collection, as well as some aggregate data collection. Data collection and the ability to show that you have a history of being able to collect good data or, you know, sort of work with participants to sort of capture the experience of either participants or the program, both successes, challenges, barriers, things that worked, things that didn't. We learn from all of that. So really, how does our applicant show that they have a history of doing that, a good track record? So then we're also looking at sort of the quality, how this program you know, actually incorporates and meaningfully incorporates working with people who use drugs, hiring people who use drugs, all of that. You know, do they talk about feedback loops within the organization? Do they talk about hiring people with lived experience, with active experience? How is the representation table? How are people who use drugs, BIPOC folks, queer folks, you know, how are they represented organizationally as well as the board? And I'll pull that up in a minute. And then again, because these are cost reimbursable subawards, so they do take a bit more in terms of financial readiness and infrastructure to be able to have cash on hand for probably what that first month will be, as well as probably a little bit more, right? Because you can only bill us and we can only pay you for work that's been done. So you have to have enough cash on hand to cover your project for that first month, and then you can start billing and pulling in timesheets and all of that. So that is one big divergence from the tier one, the lower threshold projects. And so really, how do they show that? How do you have confidence in that through their budget, through their narrative? And yeah, you know, so then really just thinking through, you'll enter in all your scores here, all of this. And then final thoughts, this is the same as the narrative basically for the AIDS United workbook, but really thinking through pros, cons, and then overall quality of project proposal. Is it unique? Would you prioritize this? Is it, do you think we'll learn a lot from it? That sort of thing. So just general thoughts about these projects and the applicants that you're reviewing overall. Okay, that's for tier two. Oh, geez, sorry. Now I will say, here is the one for tier 3, and it is identical by design. Basically, it is identical with a couple key, one key divergence. So tier 3, this kind of center of excellence, sort of enhanced demonstration project, is a little bit more wonky, public health, nerdy. So we're basically challenged. We're going to fund 2 organizations at a very high level to basically kind of create centers of excellence around building out and even doing a little research around expanded adult vaccination services on site or in close partnership with SSPs, obviously focusing on COVID vaccination services. And so we included one more category here that really is a little bit more about thinking through some of the a bit more academic-y sort of approach that we're looking for. So really thinking through, like, does this SSP already have partnerships with university systems, medical systems, community partners that they have a track record of offering and conducting, you know, really important, you know, important research into getting services to people who use drugs in the context of syringe access, a whole variety of things. So really, and it also would be probably much more detailed in terms of the type of data collected, how data is collected, whether it's research, whether it's implementation science sort of stuff. So just one extra section here, but otherwise everything is all the same. Okay. All right, I know that we are quickly running into our hour, which is fine. So our requests for proposals, all of these, if you are, you know, struggling and need review within each of the requests for proposals, that's this over here. Part 3 application literally covers all of those things, right? So feel free to refer back to that, or if you have questions, feel free to refer back to us. Let's see, and then the last things I just wanted to pull up there are two attachments in particular that we have linked to in the RFPs. One is a budget proposal. It's a template that we have made up. They do not have to use this exact template. A lot of organizations will already have their own template. Some organizations will choose to use this template, but all of these numbers in here are really just kind of dummy numbers. They're just here for to show that the formulas work and all that. So you can expect to see budgets that are similar and look similar to this. At the very most basic, these are the most basic lines that you would expect to see in a budget. So hopefully that is pretty straightforward. And then the last thing that I'll pull up is the representation table, which is, it's not as intimidating as it looks, but it basically goes through, why is this doing that? It basically goes through, you enter in the agency name, well, they'll enter in the agency name, all of this, and basically into who has sort of representation at many different levels within the board of directors, within staff, senior management, program management, admin support, and then percentage, comparing those numbers down to percentages related to the communities that each program serves, right? And estimates are always fine. So you'll expect to see this as well. So please do take a good look at this, thinking about race, gender, sexuality, drug use, age, because representation matters, and we all know that, and it needs to be prioritized, and kind of back to the concept of really baking in health equity from the outset, in terms of how we are designing and creating, facilitating this grant making project, because it's really vitally important to us as organizations that we bake that in from the beginning, from the ground, because we know there's a lot of amazing programs out there, and there are a lot of programs that kind of fall through on some of these things, or talk the talk but don't necessarily walk the walk. And we want to make sure that we are being very cognizant of that, and really thinking through equity in grant making. And so again, really, any thoughts you have about any of the applications, any of the process points, any questions about any of these tables, Angel and I all of our project teams are here to be helpful in this way, and are super available to answer any and all questions. And I'm going to stop sharing my screen because it's a lot. And yeah, right where we started, I personally really enjoy doing this type of grant review stuff. I feel like it's a great way to stay connected to programs and see what programs are doing across the country. And really, again, this is kind of really novel. This is a really unprecedented funding opportunity, and I just I get the chills thinking about it, and feel honored to really be helping to implement this project and do it right. And so again, I just super appreciate all of you, and your volunteering for this. And yeah, we're here to be supports, and hopefully this is going to be a first of many. And then in the future, we can bake in, and convince federal partners that it's important to bake in, actual compensation for this type of review. But being mindful of that, we really wanted to also just get as much money out into programs as is possible. And so, yeah, really, really appreciate each and every one of you. And we're here as resources. So, Angel, did I anything you want to add on? Did I miss anything? Did we miss stuff?
No, I think that's a pretty thorough review. I think I'd just like to reiterate some things that you said for, all the tiers. We're not as focused on like grammar, spelling. Do they articulate their message in the best way? What we're worried and concerned about is what is the project, what is the message, not how it's presented. And again, looking at that, equity framework. Not everyone has a grant writer. Not everybody has that capacity to really spend the time working on writing this grant because they're focusing on services. And, all of the tiers include that table, that last spreadsheet that you were showing that looks at like the diversity in the program, because that's important for us.
Yeah. Well, I know that, there are no questions because this is recorded, but we, again, are here to be supports and hopefully make this as light of a lift as possible for you all. I really just thank you from the bottom of our heart. And I also know that this is a tight turnaround and a busy season. And yeah, we're doing the best we can and appreciate your patience. We just want to get money to programs as soon as we can. It's a thing that I feel like we've been striving towards for a long, long time. So yes, appreciate the patience and hope you're excited about it. And we'll be in touch very soon. So again, hope everyone's having a great day, and we're around if you need us, okay? All right, talk to y'all soon. Thank you.